Each year, between 1.7 and 3 million sports and recreation-related concussions occur.
And while these injuries are common, they are often complex and misunderstood. News 9's Robin Marsh explains in today's Medical Minute.
When it comes to concussions, there's a lot of misinformation out there. In fact, the first myth is that a concussion always involves a direct hit to the head. In fact, whiplash or some type of jolt to the body that shakes the head can actually cause a concussion as well.
Some people still say it's a bruise on the brain. We know it's not that. A concussion is basically normal imaging, so there's no signs of bruising at all.
You may have heard that you should not sleep after a concussion, but this also is untrue. The University of Michigan Health says sleep can actually be beneficial. Another thing to watch out for, you have to lose consciousness to have a concussion. That's not necessarily the case. Only about 10% of concussions involve losing consciousness. And should you always go to the ER if you have a concussion? Not necessarily. If you have mild symptoms, you can be cared for at home, but make sure you follow up with the doctor. And our last myth, you can return to sports as soon as you feel okay to play.
And a lot of people think that you should, quote, fight through a concussion. Well, we know that these days that can be very dangerous and that can lead to severe traumatic brain injury.
The rule of thumb is you should not return to play sports until you have been cleared by a medical professional. Some common signs of a concussion include headache, nausea, sensitivity to light or sound, memory problems, and mood changes. For today's Medical Minute, I'm Robin Marsh.